Now, this bill has many fearing that access to abortion, contraception, gender transition surgery, or medically assisted dying will become more difficult for patients whose doctors morally object. One doctor I spoke with says this bill is actually about respecting everyone's rights, the doctors and the patients.
For people to say that physicians who, for instance, disagree with a certain medical procedure, no matter what it is, would thereby abandon their patients or not provide them options is actually not a question about my rights. It's a question about my professionalism.
Dr. Martin Owen says in Alberta, patients do not need to be referred by a doctor to receive an abortion or medical assistance in dying.
There are a few mechanisms in Alberta. For instance, abortion services are self-referral in Alberta. So anyone can go directly to an abortion provider. And that's a mechanism that if their family physician does not refer for abortion or provide abortion, then they can self-refer. For instance, in medical assistance in dying in Alberta, there is a number that they can call, or they could present to an outpatient clinic at the hospital.
Critics like Bradley Peter of Dying with Dignity say that getting timely information about options is key.
We have heard anecdotes of individuals not being told about this central coordination service soon enough. So by time they learn of this option, by time they're able to contact the central care team, they're at a stage in their illness or disease or disability where it becomes very difficult for them to make the request.
Peter finds it odd that this bill is being introduced in Alberta.
Physicians are granted conscience rights in Alberta. And in fact, Alberta goes so far as to grant entire institutions conscience rights, meaning if an institution doesn't agree with medical aid in dying, then an individual can't receive it in that institution. So it's very strange that this legislation is attempting to reinforce conscience rights when I don't think they're actually under attack.
With support from the governing Conservative Party, the bill will likely be passed. Some will say nothing will change, while others fear patients in smaller centers will be left without options.
The last thing we want to do in medicine is to be activists, meaning I'm pushing a certain choice on a patient because that's what I think is best.
In Calgary, Tara Overholt, City News.